Hello, Dr. Hyman. Mrs. S. is a 41-year-old Hispanic female who was seen in the clinic today with a chief complaint of a painful lump in her upper right breast for 3 weeks. The lump was noticed 3 weeks ago when the patient first felt pain in her upper right breast. The pain was described as non-radiating. No precipitating factors elicit the pain. However, manual palpation does intensify the pain. She has periodically taken Tylenol in an attempt to alleviate the pain. However, it has been ineffective. The pain occurs intermittently both at rest and with activity. Also, the patient believes the lump has increased in size over the last 3 weeks. The patient did not note any skin changes or discharge from the nipples. No warmth or redness of the skin is reported by the patient. She denies weight loss or bone pain. However, the patient has experienced increased fatigue even at rest. She describes the lump as being firm, immovable, and painful both with and without palpation. The pain is described as tender, intermittent, and non-radiating, scoring 6 out of 10 on a numeric pain scale. The patient denies diffuse chest pain or shortness of breath when the right breast pain occurs. The patient denies palpitations. She denies lymph enlargement or tenderness. She denies weakness or paresthesias with the pain. The patient had appendicitis at the age of 10 years old with an appendectomy. She's had primary hypertension for the last 10 years. Her primary hypertension is well controlled with medication, dietary changes, and regular exercise. She is currently employed as a waitress at a local restaurant. She is heterosexual. She is married and has 2 children, a 15-year-old girl and a 10-year-old boy. She denies using alcohol, illicit drugs, or tobacco. She is Catholic and attends church once a week regularly. She has a maternal history of both diabetes and hypertension. She has a paternal history of hypertension as well. The patient has no known allergies or intolerances. Her current medications include hydrochlorothiazide, 25 milligrams by mouth daily, and over-the-counter Tylenol, 650 milligrams occasionally for right breast pain. Her vital signs are as follows: temperature 98.4 degrees Fahrenheit, pulse 72 beats per minute, respiratory rate 14 breaths per minute, blood pressure of 124/72, and oxygen saturation of 98% on room air. She appears to be of normal weight, well-nourished, and in good overall personal hygiene. Upon inspection, both breasts appear symmetrical. No skin dimpling, thickness, erythema, or lesions are noted to either breast. No masses or enlarged lymph nodes are visualized bilaterally. No nipple discharge is noted from either breast. Upon palpation, a 10 mm by 2 mm oblong-shaped mass without definable borders is located in the right upper breast near the talus spence. The mass is firm, tender upon palpation, and non-movable. Her pain is rated 6 out of 10 with palpation on a numeric scale. The skin surrounding the mass is warm and dry. The left breast reveals no palpated abnormalities. Supraclavicular and axillary lymph nodes are non-tender and not palpable bilaterally. Gait is steady, and patient shows full range of motion in all 4 extremities, with and without resistance. Spine contour reveals normal curvature. No pain is present with movement. In the supine position, no cardiac pulsations are visualized. All pulses are palpated as 3+ in intensity. Apical pulse is palpated at Erb's point. Normal S1 and S2 are auscultated without murmurs or extra heart sounds. Symmetrical chest expansion is present bilaterally. Breathing pattern is regular and rate without dyspnea. Tactile firmness is negative. Dullness is percussed over the heart, and the lungs are percussed as resonant. The lung sounds are clear bilaterally in all lobes, both anterior and posterior. Egophony and whispered ventriloquy are negative. The abdomen is flat in appearance. Vowel sounds are auscultated every 10 seconds in all 4 quadrants. Percussion reveals the liver border, and the spleen border is unable to be percussed. The rest of the abdomen is tympanic with percussion. No pain is elicited with shallow and deep palpation in all 4 quadrants. The neurological examination is within normal limits. Differential diagnoses include breast mass, macrocyst, fibroadenoma, and phyllodes tumor. A mammogram is scheduled at Spartanburg Medical Center tomorrow. The patient is instructed to return to the clinic in 1 week to reveal the mammogram results. The final diagnosis is breast mass with pending mammogram results from Spartanburg Medical Center.